Hi, I'm Chris Bailey. If you're watching this video, there's a decent chance that you found out that you have a hernia. Although there are many different types of hernias, they all share a common mechanism and anatomical description. A hernia is a defect or hole in the abdominal wall. Your abdominal wall is there to keep your insides inside, so naturally this can create problems. Sometimes hernias are congenital. In other words, you were born with them. Other times, they are secondary to certain risk factors unique to your situation. Examples include being overweight or obesity. Increased weight places a pound-for-pound increase in pressure on the abdominal wall. Smoking, or a long history of smoking, weakens the connective tissue that makes up the abdominal wall. A long history of smoking may have made irreparable damage. Older age, as the muscles become weaker, chronic straining or heavy lifting, pregnancy, particularly multiple pregnancies, and ascites, excess fluid in the space between the tissues lining the abdomen and abdominal organs. This is often due to liver failure. Although you may be able to wait to repair a hernia, it is generally not recommended. Other clinical conditions and risk factors may play a part. There is a risk of intestines being squeezed into the hernia pouch and blood supply being cut off. If this happens, you will experience sudden pain, vomiting, and require an immediate operation. An operation is the only way to repair a hernia. Without repair, a hernia may increase in size. Unfortunately, even after surgery, there is a risk that the hernia could return. This is particularly true if the pre-existing factors that placed you at risk for hernia are not resolved prior to repair. As a result, the timing and type of operation best suited to your condition will have to be agreed upon by both you and your surgeon. Often, risk factor reduction will take priority over surgical repair in order to avoid performance of a futile operation. During this time, a supportive belt or other structure may be worn to hold the hernia in place. Today, we're going to discuss the most common pre- and post-operative concerns surrounding your surgery. For more general information, please see the video titled General Surgery Expectations. Everyone's biggest concern with surgery, including mine, are the what-ifs. This list is by no means exhaustive, but it certainly covers the majority of issues that could come up with your surgery. Regardless of the outcome, know that you will be treated in the way that I would want to be treated in every case. Wound infections are usually superficial or on the surface and can be treated by draining the site. Bleeding can happen with any operation. Every step will be taken to ensure that this does not take place. There is possible conversion to an open operation, which means a large incision and hospital admission, usually for 3 days. We would only do this if it became unsafe to continue using the small incisions. Hernia recurrence. Hernias can come back, often secondary to the reasons you developed one in the first place. A gastrointestinal tract injury is a serious complication that, if missed, could be life-threatening. Immediate intraoperative repair would follow. Chronic pain or nerve injury, entrapment. Most common in groin hernia repairs. If present, they may require additional procedures to treat. There are multiple different hernia repairs for each of the different hernia types. As a result, it would be unrealistic for me to describe each different repair here. Instead, I will describe the key points of a typical hernia repair. Once anesthesia has been induced, we will expose your belly and prep the skin for sterilization. It is normal for patients to feel self-conscious or nervous about this, but make no mistake, everyone in the room at this point is a professional, and every effort will be made to maintain your dignity. After performing one final pre-check, the procedure begins with several small incisions on your belly. This depends on the type of hernia and repair you are receiving. If laparoscopic, we will insufflate your belly with carbon dioxide. Special ports will allow a camera and long instruments inside, and we will take a look around. As long as there are no additional abnormalities, the instruments will then be used to pull your abdominal contents from the hernia and repair it with synthetic material. If open, the bulging material will be pushed back into your abdomen, and sutures or mesh will be used to close the defect. In either case, mesh is a thin plastic-like material with the same consistency of a window screen. It will be extended past the defect and fixated to the abdominal wall in a variety of ways depending on the condition. A drain may be inserted, but this is uncommon. This will keep fluid from building up in the treatment area. If placed, your surgeon will remove the drain sometime after surgery. Then, the incisions will be closed with absorbable suture and covered with steri-strips that look like small pieces of packing tape and a gauze bandage. Sometimes we will use skin glue instead. Depending on the complexity and severity of the case, you can be in surgery for as little as 25 minutes to as long as 3 hours. Most cases are finished in about 45 minutes. Know that the time it takes is irrelevant to us as long as a good quality operation is performed. These times are only meant for generalization. Do place value on the fact that you will be watched closely until you're awake in the recovery room, and your family will be notified of your condition by the surgeon and staff once the operation is complete. In most circumstances, you will head directly home after surgery. Don't be concerned, this is common and standard of care. Some of the largest abdominal hernias do require admission for pain control, but this is usually only for a few days. The person driving you should be able to handle filling your prescriptions, if not already dealt with while you're in the operating room. As with any type of surgery, it is reasonable to expect some amount of pain. This varies with individual patients and depends on your body's response to pain medication. Fortunately, there's usually minimal pain associated with this operation. The abdomen will be sore as well as the small incision sites, and some patients have shoulder pain for the first day or two. See the general surgery expectation video for more recommendations on pain control. Returning to normal after surgery will depend upon the size and type of hernia repair you had. Most patients find that a bland diet of foods such as toast, rice, bananas, soup, pasta, etc. are easiest to digest initially. After the initial recovery period, most people can tolerate a variety of foods without difficulty. Most patients feel strong enough to return to work in 1 to 2 weeks following the operation. Some may return sooner if they do desk work. If you do work that requires you to lift greater than 20 pounds or bend over, then you may need to be placed on restricted work duty until you have your post-operative appointment. If you need a letter or work excuse to be sent to your employer, please let your surgeon or nurse know. You may resume sexual relations when it feels comfortable to you. After 2 weeks, the likelihood of you affecting the surgery is very low, but the chance the surgical sites will affect you in the form of pain is relatively high. As a general rule, if it hurts, just avoid it for the first few weeks. I know things can move quickly in the operating room. Sometimes you're already home before you even think of the questions you would have asked. Hopefully this video will answer most of those questions and give you confidence after going home. Thank you so much for allowing us to participate in your care.